Yeah, there are a few takeaway messages. One is we have all agreed there is a decline in the production of local production of pharmaceutical products in the country. And the second is that there's a need to take action to reverse the situation so that we bring our local production again going up. And thirdly, that can only be done if there is a good coordination among the stakeholders. And we have identified stakeholders, and we think that the committee that already existed, that was looking into the local pharmaceutical manufacturing process, should revert its work, start its work again, and that there is a need to support this committee so that they can look into the issues that can address the decline in local production. That is a tricky question. It is yes or no. And the reason is, if we go into direct putting on duty exercises on imports, especially pharmaceuticals, we are likely to hurt the users, because the prices will definitely go up. However, we can do something else. We can continue having importation of finished products at no tax level, but we can improve the situation by removing taxes on packaging materials and raw materials for pharmaceuticals. So raw materials free, packaging materials free, because this is a huge component in pharmaceutical manufacturing, the packaging material. If you tax on that, even if you give a free import of raw material, active raw material, you still have a high price in the production cost. So by doing that, we will avoid increasing price on finished products, which will directly affect the user, but at the same time trying to improve the local industry by providing them an incentive of free import of packaging materials and other subsidies for pharmaceutical manufacturing that will later compensate in their price, and we will become a bit competitive with imports. Yeah. My personal feeling is no. And that is, you see, because in the 90s, when I worked with the Minister of Health, there were so many applications of foreign investors who wanted to establish pharmaceutical industries in Tanzania. And all those applications were actually approved by the ministry, but none actually materialized. So I think there is a problem in somehow, and it needs to be readdressed, this one. Manufacturers can be supported in several ways, but one of them that many countries do is you have a protected list. You have a list of products that you have agreed these are for local manufacturing. And so you encourage them increasing until we get 100% coverage of this. So you reduce the import of those products every year and increase the local production, all right, on those lists. So at the end, the local manufacturers become strong enough and they can invest in additional products. But if we don't do that and we don't protect them by providing them an incentive to do it, they will definitely not produce because the competition will be too high for them. In fact, having a local manufacturing system improves availability because it reduces the lead time for procurement. So whenever you have the money, you can easily buy. Take an instance, if we want to buy it at the time when we have money, but we have to buy it outside, it will take us up to 6 months until we get the product in. This is a long lead time and therefore will result. So for me, if we buy locally, if we encourage the local industries to produce and buy locally, will improve availability of essential medicines in Ghana. And the other thing that we should support the local industries is that there should be a certain percentage. If, for example, if we have an international tender where our local companies also bid, there should be an advantage of price. Formerly, MSD was putting about 15%. If a local manufacturer has a 15% more in price than an international, we would give that bid to the local manufacturer. Now with the rising costs, I think this 15% is no longer variable. It must be a little bit higher than this. Yes, it is cost, but then is a cost of investment, because finally these companies become strong and they will be able to compete. Yeah, so to me it would be a nursing situation for a short time, and then they will go on their own.
The main takeaway message is that there has been a consensus that the local pharmaceutical manufacturing sector, the role of the local pharmaceutical manufacturing sector in the country is declining, in spite of the fact that the market is expanding. For example, way back in 2009, the total pharmaceutical consumption within the country was around $90 million. Today, and the share of local pharmaceutical manufacturers was around 35%. Today, local pharmaceutical consumption within the country of month is around $250 million. But the share of local pharmaceutical manufacturers is less than 20%. So it is declining, no doubt, while the market is expanding. Therefore, the message that has come out of this meeting, dialogue, very clearly, is that there's a need to address this challenge and reverse it, and that certain appropriate actions must be taken in order to accomplish that. Certainly. But we should be under no illusion. The local established installed capacity cannot satisfy the demand for all pharmaceutical needs in the country. However, what we need to do, first and foremost, is to come up with a negative list of all those products that can efficiently and sufficiently be produced by local manufacturers, and duty be imposed on importation of those items in the negative list. Otherwise, we shall be punishing the patients without any good reason. Promotion of competitive and efficient pharmaceutical environment is one. Facilitation of increased investment is two. Strengthening of regulatory capacity. Development of appropriate skills and knowledge in pharmaceutical production is essential. Utilization of TRIPS flexibilities towards improved local production. For example, we have been talking about this since the year 2005, that we need to change patent law, the country's patent law, because as it is obtaining, it is not supportive of local industry. And what we needed to do was to take out the appropriate chapter in the patent law and replace it with the stipulations of the Doha Declaration. But that has not been done to date for no apparent reason. So that needs to be looked at. The putting in place the legal mechanism that will support industry. And lastly, mainstreaming innovation, research and development within the country, and probably collaborate with other countries within the East African region.
In terms of investment in research and development?
Giving preference to local manufacturers. Currently, there is a policy in place in the country which needs to be supported by other policies, whereby local manufacturers are given 15% price advantage plus what we call price equalization factor of between 6 to 8%. Meaning, if a local manufacturer quotes for a product for say $120, and a foreign supplier quotes for $100, then the bid goes to the local manufacturer. That has been working, although sometimes there is a tendency to ignore it by the procurement agents, but it has been there as a matter of policy, and this needs to be strengthened.
Thank you very much. What we have been talking here is how to make the manufacturing sector, which is producing for medical, for the health sector, to make it grow and competitive. So technologically, in order to meet the requirements of GMP, you require technological learning and moving up the technology ladder in terms of quality and complexity. But this requires innovations. And we are saying innovations are done not by one actor, but they bring together actors together, like in a system. So firms which are producing need markets, they need finances, they need supportive government policy, they need supportive research, supportive academia, so that many actors need to come together in a system in order to be able to move the sector technologically up the ladder so that it's more competitive and it can produce, can meet better the requirements of the health system. So the innovation system is that system of actors acting in unison in order to facilitate the improvement technologically of the supplies from manufacturing to the health sector.